So this is a CT head. I'm going to kind of go between X-rays and CT, and then actually thanks to the person that actually donated a case, we've got a decent MRI as well, very decent MRI. So I'm very, very grateful for that. We're going to be looking, so we're going to kind of gear it towards most people's ability, because obviously we have a fair few people who are just interested, and some people actually do this day in and day out, right? So first off, let's go from the very, very top. We can see that this is an axial, so right from the top to the bottom, CT scan of a patient's head. And scrolling through, when you actually look at these sort of kind of crevice areas here, you can see these CSS spaces, they look kind of large. So they must be older, all right? They're not going to be a young patient. As you come further down, you can see that there's a little bit of low density located within these regions. So they've got a little bit of something called small vessel disease. And that's something that's very natural, can happen to people as time goes on. Normally in a periventricular location, doesn't usually go all the way to the edges of the brain parenchyma either, and it can be very common, and you can get sort of gradings of it. So you can have like mild, moderate, severe, and people, may want to report on that just to give an idea about the age of the patient. So as we scroll through, we can see the CSF spaces are here, and actually it all looks very, very symmetrical, doesn't it? And we have got the poll, and a few people have gone for a few different things. Okay, so but most people have gone for one of them. So I'm going to end the poll there, and then the results should come up. So most people have gone for a subdural hematoma that they can see. So this can be a bit challenging, this one, because subdural hematomas are usually sort of crescenteric shaped ones. So if we do, let's get rid of that. So crescenteric shape should be like a crescent moon, right? Like this. And a extradural hematoma is going to be like this, right? And someone actually told me that one looks like bananas and one looks like a lemon, right? So I guess a banana would be the subdural hematoma and the lemon would be the extradural. Now, my mind still can't work with that. So what I end up doing is using a different kind of way. Is that, if you've got like a pair of glasses, right, like this, I can't even draw them on here right now. So pair of glasses like this. So they need, someone who's got glasses need an extra pair of lenses for extra eyes, and therefore this would be a subdural, extradural. So extra eyes is a lentiform, a lens shape, which would be an extradural, and the other one, the opposite, would be a subdural, right? So a few people have said they can see it. Okay, good. So when we're coming from the top, you can actually see there's some extensive, what looks like high density material located against the falx, and that can be very, very common. You can actually get calcifications of the falx cerebri, very, very common. And as you come further down, it kind of becomes a bit less so. But when you come down here, you know what, maybe it's not, because actually this looks very, very dense over here. And then if you look at the tent over there, it doesn't look so dense, and this area doesn't look as dense, right? Coming along like so, it starts to look a bit wavy and hazy, not quite that sort of calcified appearance that you have anywhere else. And it continues to be like this all the way along like this as well, right? So remember, the head is like a 3D structure, right? So if someone has a bleed and they're standing around and trying to, maybe they're not lying down straight away, it can actually sort of start to pull downwards, and then just lie along the tentorium. And so I just quickly showing the platform, which I think really is awesome, that you can pretty much use all the planes that you normally use. Obviously, this is slightly thicker slices, which looks a bit pixelated, but the thinner slices would be a lot better. But you can see like how if you've got a bleed, it can start to pull down like this and come kind of sitting right along the tentorium. And that's exactly what's happening here. You've got blood sitting along the tentorium, so therefore this would be a subdural hematoma, right? And the way I'd actually report it would be a thin subdural hematoma that is lying along the falx cerebellum. And thankfully, the other things that we want to be making sure of is whether the person's got any mass effect as a result of it. And mass effect is where, if you've got a very, very big bleed, you can end up having sort of mass effects of things being pushed in the wrong direction, and that can result into a massive cascade of problems. But here you can see there's no real push of anything. Everything looks very, very midline. The CSF spaces look okay. So there's no significant mass effect from this subdural hematoma. So what we'd have to just say, like, there is a subdural hematoma, and they may want to get neurosurgical opinion if the patient's very, very confused, very, very well, may need to have further investigations. So a few people have got that. That's really good. Well done. Really, really impressed so far. Hopefully I have some challenging cases for yourselves coming up soon.